Good afternoon. Dr. D. Roach here. Talk a little bit about COVID. It's been a while since we've had a chance to visit about it, and I'll try to bring you up to speed a little bit about where we are, community, state, and nationwide. As you know probably, with the Delta variant, our resources have completely been saturated once again, not just locally, but with all of our regional resources across the entire state. So COVID-19 is alive and well once again. And so our challenges are certainly great going forward. All the things that you hear and have heard for months, they're still true. The things that we can do to help limit its transmission are still in place. We encourage you, if you're going to be in a high-risk circumstance, to certainly wear your mask. Try to exercise social distancing wherever it's appropriate. Hand washing technique, all those things are still just as true as they have always been, particularly if you're going to be in circumstances that places you at a high risk for being exposed to COVID. The one thing we do have now that we didn't have before, of course, is the vaccine. And there's been certainly a lot of conversation and discussion regarding the vaccine itself. Currently, there are primarily 3 vaccines available to the public. Johnson & Johnson is a single shot. Moderna and Pfizer are both the 2 shots. Pfizer is 3 weeks apart, Moderna is 4 weeks apart. The advantage or disadvantage, if you choose, would be that it seems that the Pfizer and Moderna vaccines do have some decided advantage of efficacy over the single Johnson & Johnson injection. It's particularly true with the Delta variant. So there's also been a lot of controversy, of course, with the vaccine itself. Unfortunately, the vaccine has been made into quite the political warhead. And so, unfortunately, we have to deal with the fallout from that. The fact of the vaccine, very simply, is that it is, in fact, safe. This is a vaccine unlike any that you have ever seen before. With previous vaccines, they have all been made based on some version of an attenuated or weakened viral particle that's introduced into your body to elicit an immune response. This vaccine has no viral particle to it whatsoever. On the surface of the coronavirus, there is a protein called spike protein or M protein that is actually the fingerprint that identifies it as coronavirus. The vaccine is a genetically engineered RNA vaccine that particularly and explicitly recognizes the spike protein or M protein, and in doing so elicits an antibody response in your body once you have received the vaccine. Take-home lesson is that, number one, it's extraordinarily safe, and more importantly, it's extraordinarily effective. We try to rely on data to make our recommendations and decisions, and in this particular instance, the data is pretty much undeniable and inarguable. Currently, 95% of all new diagnosed COVID patients are in the unvaccinated population. Most recent data across the state of Texas, 93% of all ICU admissions for COVID are in the unvaccinated population. So I think the data speaks pretty clearly for itself. And by the way, somewhere between 88 and 93% of current new cases, depending on which study you believe, are of the Delta variant. So I think that's the trend that we're seeing right now, and certainly one we would expect to continue. So as far as testing availability here locally, we have a couple of options. One, of course, is the rapid antigen test. The other is the antibody or PCR testing. PCR testing is considered to be more accurate, and of course we do have both of those available for people who are concerned about exposure or who are exhibiting symptoms. If you get tested and find yourself to be positive, the rules have not changed. You need to quarantine, and quarantine is expected to be mandatory of you, and so that's part of limiting the dissemination of the disease. If you get it, quarantine. For people who are positive that are in the higher risk stratification, there's also available now locally, not just one but 2 different regimens of a monoclonal antibody in the form of an infusion where you actually get an IV started We have had Regeneron, which is one of the brands of the monoclonal antibody. Just today, in fact, there has been approval for the second combination of bamlanivimab and a second antibody called ETI. And so we will have both of those available, again, depending on how our pharmacy is supplied. These are delivered to us on allocation, so we get what we get, and we hope that we have enough for everyone. But just to enforce, those are intended for people who are at high risk for having potentially a less than good outcome if they do in fact come down with the COVID infection itself. For those people who have more challenging clinical courses and require hospitalization, hospitalization is primarily predicated upon how well you're able to maintain your oxygen saturations, and if you're able to do so without supplemental oxygen, then you can do so at home. For those who do require inpatient care, there's an extraordinary amount of variability from one facility to the next as far as exactly how those are managed. What we do know is this: oxygen helps. The second thing that we do know for a fact helps is corticosteroids. Particularly dexamethasone is the one that's been studied the most. And certainly we both offer those here in the inpatient setting. Additionally, we also have an remdesivir, which is an antiviral drug, and anticoagulants are the other thing that is typically used in the treatment of COVID acutely. What we've seen with COVID is that there's basically two phases to treating this infection. The first phase is geared more primarily toward the antiviral component of it, which is where your remdesivir therapy would come into play. After the first 7 to 10 days, the treatment of COVID becomes a little bit more challenging, because at that point, symptoms are not as much related to the infection, but more related to an exaggerated inflammatory response from the body, at which time the corticosteroids are much more effective. And that's why we maintain them on them both. Anticoagulants are used because part of the inflammatory response occurs in the endothelial surface, or the inner lining of the blood vessels, which can cause swelling and ultimately obliteration of the blood flow. And that's why we see late in the course multi-organ failure, because of the disseminated intravascular or interepithelial inflammation. There are a myriad of other options available for treatment in the acute phases, including, everybody remember the hydroxychloroquine at first, absolutely no data to support that it has done any good whatsoever through treatment. Ivermectin is another commonly encountered therapeutic intervention. And there are plenty of anecdotal stories out there available that you can read and find out whatever you want to find out from it. Our attitude and philosophy here has been consistent from day one. We require, in order for us to implement a certain treatment program, that there be appropriate studies, non-biased studies, to support its use. We require double-blinded, randomized prospective studies to evaluate the efficacy of any drug, and that's why up to now we have not chosen to employ anything other than the remdesivir, steroids, anticoagulants, and respiratory support. Right now the data just does not substantiate that. With time we may find it to be true that these things actually do have more benefit. The other consideration, megadose vitamins. Certainly vitamins are important in help fighting some of these viral infections particularly, but there's been no proof that megadose vitamins does anything more than your usual minimum recommended daily requirements at this point. So there is a lot of confusion. We understand it, and we're doing our best on our side to try to sort through all this data as best we can, assimilate it, compile it, and make the best choices available for you, our patients. We appreciate the support that you've given our medical community throughout this entire pandemic, and vow that we will continue to do the same for you in return. We do have a COVID hotline. It's available to call. The number is 728-3431, extension 7070. If you have particular questions about COVID vaccines or monoclonal antibody infusions, questions should probably be directed there first, and then if we can help out from there, we'll certainly do so. Please be safe, exercise precautions, and stay well.